What are the non-modifiable risk factors for cardiovascular disease? Cardiovascular disease can be caused by a variety of risk factors we cannot control. The older you are, the more prone you are to chronic conditions like heart disease or stroke. However, men have a higher risk of cardiovascular disease earlier in life, while women are more at risk after menopause. Women may also experience different symptoms of heart attack that may go unrecognized. You may be more at risk depending on your ethnicity. People of Asian, African, or First Nation descent have higher rates of cardiovascular disease. Your ethnicity may also influence your diet, which can put you at an increased risk for cardiovascular disease. If you have a first-degree relative who has had cardiovascular disease or a stroke before the age of 55 for men and 65 for women, your risk of heart disease doubles, and regular screenings with your doctor are recommended. But there is good news. Up to 80% of premature cardiovascular disease can be avoided and more effectively managed by taking these proactive steps. Quit smoking, be physically active, eat well, achieve a healthy weight, manage your stress and any anxiety or depression, and see your doctor about managing your cholesterol, blood pressure, and blood sugar levels. For more information on cardiovascular disease, please visit our website.
BEaTS Radio, scientists interviewing scientists. Canada is a worldwide leader in science and innovation. However, our communities need to be more connected to current scientific research in order to drive the future of scientific innovation. So what steps can we take to more actively engage and connect our community with scientists and vice versa? Innovation and discovery are at the core of the current efforts of our government, but science sometimes gets slightly complicated to understand. At BEaTS Radio, we will tackle this by having young scientists and early career researchers interviewing scientists and innovators. By dissecting science in simple terms, this will allow our community to better understand the importance of science for our country. Hello, and thanks for tuning in to BEaTS Research Radio. My name is Hallie Arnott, and I'm the Canadian Biomaterials Society Ottawa Student Chapter President and a graduate student in biomedical engineering at the University of Ottawa. And today I'm back here as your host on this episode of BEaTS Research Radio, where we stream from an active lab at the University of Ottawa Heart Institute. Our goal here at BEaTS Research Radio is to communicate scientific research that's being conducted in labs and hospitals and explain how it makes its way into the clinic and translate into public health. What is interesting about our show is we have early career researchers and scientists who are just learning, interviewing scientists who are established in their field. Before we get going with our interview, I'd like to thank the University of Ottawa Heart Institute, eLife, the Canadian Biomaterials Society Ottawa Student Chapter, and the Department of Biochemistry, Microbiology, and Immunology with the Faculty of Medicine at the University of Ottawa, who are supporting us here at BEaTS Research Radio. Also, don't forget to subscribe to our YouTube channel, and also you can visit our podcasts on Spotify, Apple Podcasts, and Google Podcasts. With us today is Dr. Kelly Cobey. Dr. Cobey is an investigator in the Clinical Epidemiology Program at the Ottawa Hospital Research Institute, where she works as an active member of the Center of Journalology. Dr. Cobey also acts as the center's publication officer, where she provides education and outreach to researchers, both internal and external. In addition, she also works at the Ottawa Hospital she's an adjunct professor with the University of Ottawa in the program or in the School of Epidemiology and Public Health. She also holds an honorary researcher appointment at the University of Stirling with the Department of Psychology. Dr. Cobey's research interests include publication ethics, publication models, clinical trial reporting, and peer review. And today we're going to be talking a little bit about publication ethics as well as predatory journals. So do you mind giving us a little bit about and a little information on your background and how you became a researcher in this field?
For sure. So thank you firstly for having me here. It's a great opportunity.
Thanks for coming in.
To share. My background, I'm Canadian. I did my undergrad here in Canada with my master in psychology and biology. Okay. And then I moved abroad to Europe where I studied biology and then psychology respectively for my master's and PhD.
Okay.
And when I was done that, I did a fellowship as well as worked as a lecturer in France and Scotland. So I moved around quite a lot. And through that experience of my initial training, I think what I found was that I was really struck by the lack of regulation, lack of rules, lack of training in very basic processes related to research. So my own research throughout my studies was not related to journalism per se. It gave me the experience as a researcher, though, to see how the system functioned and how it worked. And it allowed me to sort of question different aspects of the system. And with that in mind, in my training as a social psychologist, which gives me a lot of the method skills, I started to want to look more at the science of science itself, as opposed to sort of a clinical topic or a research topic focused around a particular question. So at that time, Dr. David Mower, who's based here and is the director of the Center for Journalism, advertised a position, and I applied and was fortunate to be selected, and the rest is history. So I've been here almost 5 years working with the center and working on topics, as you say, related to publication ethics and science.
Okay, so a little bit about meta science. So this is kind of the field you're working in. Could you explain to us what meta science is and how you would go about conducting any research related to that field? Yeah,
so meta science is sometimes described as the science of science. So it's sort of a bird's eye view at how the scientific system is working, because it's a little bit ironic, but we as scientists conduct science in a very rigorous way, often according to very firm protocols or the experimental method. And then yet the actual system that we operate in, be it the way we produce our papers, the way they're peer reviewed, the metrics used to assess us as researchers, is not always evidence-based. So meta science looks at the sort of science behind the science, and in my particular case, I focus on the end phase of the research continuum, which is the publication or the dissemination of the knowledge. But other meta scientists might look at sort of earlier phases, like the grant writing process, for instance, or the actual methods used. But my focus is on the sort of dissemination and publication.
Okay, once the publications. So the research that you conduct, do you conduct it based on publications that are already out there, and those are kind of your pool of where you grab knowledge from?
Yeah, exactly. So we use methods from epidemiology or social sciences, and we often extract from the existing published literature. And when possible, for instance, if journals are kind enough to allow us to see sort of in the black box of how they operate, we can look at how peer review is conducted, for instance. We can also approach it via surveys as well, so we can ask people about their experiences doing things. But for sure, we often look at, say, the reporting quality of published papers and see how that might differ after we've intervened with some sort of intervention. So for example, if a journal adopts reporting guidelines, which are checklists of essential information papers should report, after that adoption, does the quality of reporting improve? And if yes, fantastic. If it's not completely optimal, what else can we do to sort of integrate that intervention to improve or enhance the reporting?
Okay, yes. So something that I guess you come into contact with a lot is publication ethics, and probably maybe more so now than before. Could you tell us a little bit about what publication ethics is?
Yeah, for sure. So publication ethics is sort of the responsible conduct of research, but also the dissemination or publication of that work. So for me, I think when people think about publication ethics, even many researchers, they often jump to things like fabrication and falsification. So these are extreme publication ethics behaviors that are obviously wrong, but it's much more nuanced. So there's things like, for instance, aspects of data management to ensure that you have version control and accurate record keeping. That's part of publication ethics. Authorship is part of publication ethics. So authorship is something that's often learned on the job. It can be something that's quite conflicting between teams. There can be issues where authorship disputes arise. So that's part of publication ethics as well. There are other things, for instance, conflict of interest reporting, which I don't think people necessarily always associate with publication ethics, but it's an important component of transparency and anything really about the transparency and dissemination of a paper or research relates to publication ethics.
Right. So as you said, a lot of it is kind of learned on the job, learned while you're trying to write the paper. How would a student go about learning this maybe before? Is this taught at all?
That's a great point. So I think in our Center for Journalism, we feel very strongly that this should be a core component of graduate training. So every student should take a course that touches on aspects of journalism that prepares them for navigating the publishing process, navigating issues around authorship dispute, conflict of interest, and so on. Unfortunately, that's very rare, and where it does occur, it's very patchy. Most people learn on their job from their supervisor, who themselves might not be up to date because there's changes in this landscape. So we definitely think there should be mandatory graduate training. We actually are really happy and fortunate right now. We have the first course we've run at the University of Ottawa, just started last week. So it's within the School of Epi, and we have a cohort of students that are joining that, and we've received very positive feedback. Just yesterday, when I was teaching, the students were saying how very practical the skills were. So I think it's very sort of discipline agnostic in the sense that these are skills irrespective of your research approach or your clinical area that everyone needs. For those that don't have a course, within Canada, the main document around sort of publication ethics is something called the Rcr Framework. And that's something that you could check out. It's maintained by the Secretariat on Responsible Conduct. They also have a webinar. That would be an approach. And you can check out our website because we have a lot of resources on the website. We run workshops. So we're really trying at a local level, but also at a global level to raise awareness on this topic.
Right. So if someone hasn't learned this or doesn't know, when the publication has been published, is there a way, let's say that there was a publication ethics were violated, is there a reverse process that happens? Like, let's say maybe the authors were not in the correct order, or maybe the conflict of interest wasn't stated properly or at all. Is there a retraction that needs to happen at that point?
So certainly, like, depending on what the situation is, you could either correct the record, so that you could the correction to the paper, or if it was something like fabrication or falsifications, you would definitely expect to retract that. And what a good journal should do is honor that request and make a note on your paper about why the correction occurred or why the retraction occurred, and if it was a correction, what it was. So that's becoming more and more common. I think even when I started my career, to have a paper corrected was like very stressful for an author. But now it's like we appreciate that it's a very complex process. Sometimes mistakes are made. Sometimes omissions occur. And when they do, we have a responsibility to correct them. And I think people are taking that responsibility more. Okay,
that's good. So what do you think maybe the main culprits are for the poor publication ethics, or what do you think arises more often?
I think that in general, why issues around publication ethics occur, there's sort of two things. One is the lack of education, which we sort of touched on. So I think sometimes people are just completely unaware. And that can be people early on in their career, but it can also be more senior people. I've seen it, for example, with clinicians that I work with. They don't have necessarily graduate training in research, but they're active conducting research, and they have an important perspective to bring to research. But they may have even less training in publication ethics and the responsibilities that come with publishing. The other thing that I think can create issues with publication ethics is the system that we operate in and the metrics used to assess researchers. So people talk, and I think it's fair to say there's a pressure to publish. There's this publish or perish mentality. So I think that and the metrics used to assess researchers often pushes people to, for example, cut corners or rush things, or not necessarily take the same diligence that they ought to.
Right. Okay. So on that kind of same line, does predatory journals, do they fall into this category of poor publication ethics?
Yeah.
More on
So
the, I guess, less on the publisher, or more on the publisher side, less on the researcher side, maybe?
yeah. So I think it's a little bit of both. Definitely. Publishing in a predatory journal, which I should say is basically a journal that's sort of dubious. It has self-interest. It doesn't
Right.
necessarily uphold best practices, may not be indexed, for instance. That's not something we want to do. That's not something we would want. It's not an effective way to disseminate our research, right? Because
Exactly.
if it's not indexed and it's not read, that's not a great choice. But I think that sometimes people publish there consciously because of the system of incentive and rewards. It allows them to add another publication to their CV, right?
Okay.
So where we work in systems that count number of publications, there will be a proportion, hopefully small, who continue to do that. I definitely think it's a violation of publication ethics. We, as researchers, need to be aware that just like, when you're conducting research, there are particular responsibilities. When you're publishing, there are responsibilities too. And we need to be trained on those responsibilities, and we need to work to ensure we're meeting them to avoid inadequate dissemination of our research, because it's often taxpayer funded. Maybe patients have been involved in some way, and I think it's really unfortunate if that work goes to somewhere that it's not optimally used.
Right. So these predatory journals, where would they originate from? Who would create them, without being indexed and things like that?
So we don't really know a lot about exactly who makes them. There are some specific journals we know who is responsible for, but I think in a lot of cases it's just individuals creating websites and circulating them almost at random. It's not entirely clear how they solicit. You'll know as a researcher that often, as soon as you publish your first paper, you start getting solicitations from really quite random journals that maybe are not specific to your area, and they're inviting you to submit your work. And why these journals are doing this is that, depending on the publication model a journal has, in some cases, journals actually take in money from researchers when their article is accepted. So what these journals often do, or can do in some instances, is they solicit papers to make money, and they don't really care about the quality. So from their perspective, they're making money. From the researcher perspective, it allows them to publish, which is one of the metrics used to assess them. So we know there are quite professional predatory publishers and journals. One large one, for example, is called Omics, and it, because of its dubious practice, its lack of transparency, and issues around its sort of business operations, it was actually fined $50 million from the U.S. Federal Trade Commission.
Oh, wow.
So that was that was the major publisher that most people know of. But there are smaller outlets or single journals that I don't know who creates them, and I think that that's an important question to address. And I think it's going to be hard to, because, for example, you and I could sit here and create one right now.
Right.
And it's hard for anyone to prevent that, and especially the way they operate. They're sort of fly-by-night operations. We've seen in our research on predatory journals where, we've taken a sample of what we think are predatory journals to study them in some way. And throughout the course of our study, which maybe is just 6 weeks, it's
disappear.
gone. We can't click the link and it's no longer available. So they're very shoddy outlets.
Okay. So how would one go about identifying a predatory journal if you're looking to publish your work, and maybe you're a researcher who's new in your field and you might not know of the big journals to publish in? What are the red flags that you would try to look for?
Yeah, it's a very important and practical question. So many predatory journals use an open access model.
Okay.
So if a journal says it's open access and you're not familiar with it, one thing that I would say you should do is check something called the Directory of Open Access Journals, or the DOAJ. It maintains an index of journals that are sort of thought to be vetted, that are open access. So that's a good starting point. In terms of other red flags and things to look for, our group actually just worked with an international group of collaborators to come up with a consensus definition of what a predatory journal is and what characteristics it has.
Very helpful. So
that's something that you can definitely use as a resource. But even more so, we're looking to operationalize that now. And in the future, for example, we're working with a little bit of funding now to create a digital tool. And the idea is that researchers could go to a journal and they could click a little plugin button, and out would pop say a donut-like symbol with a score or an indication of the quality of that journal.
Okay. Wow.
So that's something we hope for in the future. Currently, I think use the DOAJ. you can look at our definition to see the features that are common to predatory journals. And if you're not published there, you've not read there, and your colleagues, when you consult more senior mentors, if they are not aware of it, there's so many journals, go elsewhere.
Right.
You can also look at where it's indexed, or if it is indexed at all. So you want to make sure that where you're going is going to be read and accessible by others.
Exactly. So who would determine, other than the research that's being done, who would determine if a journal is predatory and maybe put on a list of some sort?
So right now, there isn't a sort of a body or individual who does this. There used to be something called Beal's List.
Okay.
And Beal was a librarian in Colorado, and he maintained a list of possible suspected predatory journals. But as you can imagine, like one person doing this for the whole academic community was not it was not easy to do, and I think there were some shortcomings of the list for that reason. And I think now the DOAJ, as I mentioned, is a great resource. There is a commercial product as well. It's called Cabals. Because it's commercial, it presents a barrier for many people to access. So I've never even accessed it because resources are tight and institutions have to decide how to spend their money. Right. And I don't know much about the quality of that list because, again, it's commercial, so it's behind a paywall. But what I would say in terms of what we're doing is, now that we've established a definition of really what these journals are, we can now work to develop policies from that. So this definition was just published about a month ago. Okay. So it's a space we're very active in presently.
Okay. So let's say back again to being an early researcher and having an idea of where to publish but not totally sure. Let's say that somebody does publish in a predatory journal and they didn't know, and now they found out that it's a predatory journal. How would that person maybe go about retracting it, or what would be the next steps?
Yeah, it's a great question, and I've seen it for very senior researchers too. So it's not always just junior colleagues. I think what I would try to do is try to get the article retracted from the journal. With that said, so that would be a letter to the editor you've corresponded with. It's not always easy because they don't operate in sort of necessarily good faith or as you'd expect according to best practice. But I would really try to do that. The other thing that I would do immediately is create a postprint or even a preprint, so to speak, of the work, so that it's available openly in another format, say through the UVO repository, so that others can actually read your work. Because if it's in a predatory journal, chances are it's not going to be. So that way your work is still being disseminated. If you've not signed a contract, like many of these journals don't have those sort of formal processes you'd expect, and you've requested retraction a couple of times through the editor or other members of the editorial board, I would submit elsewhere and make it clear in your letter to the cover letter at the Genuine Journal saying that, a sort of pre-version of this paper does exist on this website, which you unfortunately believe is now predatory. So be very transparent about the process, but make sure your work does get disseminated.
Okay. Yes. And is there a geographical kind of trend to where these predatory journals originate from?
So there's been a few studies on this. So I think there was a sense within the community that this was a problem within particularly Southeast Asian countries and India. That's where this problem originated from, and that's where this problem affected researchers. But actually, in work that we did in 2017, we showed that the predatory journals were impacting scholars across the world. So in a sample that we took of more than 2,000 articles in presumed predatory journals, what we did is we extracted information, including the author name and their affiliation. And what we saw, for instance, was that the USA was in the top 10 of our nations in our sample. And this was a biomedical sample, so it may differ in different fields. We saw, like, when we looked at institutions, Harvard was among the top 10 in our sample as well. So I think that really flipped things on its head in terms of the understanding that, this was a global issue. It may be that the journals themselves are often created in Southeast Asian countries, but researchers across the world populate them with their research. And in that work, we even found, we looked at the funding of the research papers, and many federal funders had supported the work. So that's really problematic, right? Because that means, taxpayers, their money is going to support work that's not read, that's not used. And in clinical work in particular, but in even preclinical or discovery work, when a systematic review is done, these studies are less likely to be captured. And with clinical work, that means that they don't get taken up and synthesized and support things like clinical practice guidelines, right? So a form of publication bias when good work ends up there.
Okay, interesting. So is there any way that we can or what would be the methods that somebody would go to clean up the internet of these predatory journals?
It's tough, and like I think that as I said, like, you know, new ones can be created all the time.
Yes.
They're very difficult to identify because
everywhere.
Yeah, they're not indexed, right? So it's not like we can just go to a list and say, okay, let's, for instance, our institution could block the web addresses of these sites because they're not good outlets for our research to be disseminated in. But they're really hard to pinpoint and keep sort of collect the records of. That's why we're hoping our digital tool that we hope to develop that would look at sort of individual sites could be a tool for researchers or institutions to, you know, click on and see, like, okay, well, we can make a policy around the scores from this tool that would say this is probably not an outlet that we would favor. And different jurisdictions may have different sort of standards and what they prefer. But yeah, we're hoping that tool is very practical. But it's very difficult to actually get rid of the sites online. What I think is more effective from a policy perspective and from a institution perspective is to change the metrics, because these journals will go away if we stop the flow of manuscripts to them, right? There's no point for them to exist if they're not making money, they're not getting submissions. So I think in that sense, if we're able to change the metrics so that we value things like quality of research as opposed to the quantity of studies that we produce, that will help a lot in that sense.
Okay. So more don't publish in them and they will disappear.
Exactly.
So just one last question before we take a break here. You mentioned in the study that was done in 2017 that the United States was in kind of one of the top percentages that was publishing in these predatory journals. Did Canada come in there at all, or did you see where was Canada on that stage?
I don't remember exactly where Canada was on the list. There was definitely Canada on the list. There was institutes like locally, so the Ottawa-based institutes were also on that list. So I think it just goes to show, you know, how pervasive the problem is. You know, we are one of the only centers of journalology or meta science globally, and I think we do a good job at our institute at trying to raise awareness about this, and still these problems can persist. So I think it speaks to the real fact that these are pervasive issues across different countries, but also different levels of scholarship too. Like I've seen very senior colleagues who on the one hand publish in, you know, these perceived high impact journals. The same year they have a predatory journal publication. And I think that it can happen more easily than people realize.
Right. Well, thank you very much for speaking with us in this first segment. We're going to take a short break and we'll be back for our second segment with Dr. Cobey in just a few minutes.
Thank you.
What are the non-modifiable risk factors for cardiovascular disease? Cardiovascular disease can be caused by a variety of risk factors we cannot control. The older you are, the more prone you are to chronic conditions like heart disease or stroke. However, men have a higher risk of cardiovascular disease earlier in life, while women are more at risk after menopause. Women may also experience different symptoms of heart attack that may go unrecognized. You may be more at risk depending on your ethnicity. People of Asian, African, or First Nation descent have higher rates of cardiovascular disease. Your ethnicity may also influence your diet, which can put you at an increased risk for cardiovascular disease. If you have a first-degree relative who has had cardiovascular disease or a stroke before the age of 55 for men and 65 for women, your risk of heart disease doubles, and regular screenings with your doctor are recommended. But there is good news. Up to 80% of premature cardiovascular disease can be avoided and more effectively managed by taking these proactive steps. Quit smoking, be physically active, eat well, achieve a healthy weight, manage your stress and any anxiety or depression, and see your doctor about managing your cholesterol, blood pressure, and blood sugar levels. For more information on cardiovascular disease, please visit our website.
Hello and welcome back to BEaTS Research Radio. Here with our second segment, we have Dr. Kelly Cobey. Dr. Cobey is an investigator in the clinical epidemiology program with the Ottawa Hospital Research Institute, and she's also an adjunct professor with the School of Epidemiology and Public Health at the Faculty of Medicine at the University of Ottawa. And today we're speaking a little bit about publication ethics and predatory journals. So to get back into our conversation, I had a question a little bit about open access journals, and do you think that these are the best mode to transfer your work to the into the publication world, or maybe some that are have a fee? Is that a little better because maybe they're a little bit better in terms of maybe not being a predatory journal?
For sure. So, open access journals, as sort of the alternative, it would be a traditional or subscription-based journal. And just so the viewers know that open access means that it's freely available for anyone to read and to build upon as well. So they can use that in whatever way typically suits them. There are different types of Creative Commons licenses, but in many cases, that's the result. Whereas the traditional subscription model is only those who have a subscription license to the journal can access it. So from my perspective, I think that there is often a moral imperative to make work openly and publicly available. So I definitely think that we should try to publish our work in open access formats. It doesn't always have to be an open access journal though. So many subscription-based journals will, for instance, allow you to pay a fee to make your article open, or you can do something which is called green open access, and that's basically archiving a version of your paper to make it freely available, sometimes after an embargo period of 6 months to a year, for instance. But I think that at least through that green open access, every article our institution publishes could be openly available. And it should be. In terms of selecting a journal, which I think you're saying here is open access, the way we should be going. I think that there are a couple of factors we need to consider when we're making a journal selection, and readership is certainly one of them. So are we aiming for patients to read this? Are we aiming for clinicians, other research scholars? Is it something specific to the Canadian context, or is it something more global? So you need to consider those factors, and sometimes the best fit for our work may be a subscription-based journal, but there are actions we can take to still make it openly available.
Do you find that in your research you see more predatory journals being open access than a subscription-based?
Yeah, so it tends to be that predatory journals, in general, there's a sense that they came about through the open access model, so the ability to publish something for a fee. But with that said, for instance, the consensus definition that we reached with our community of international scholars on what a predatory journal was, we actually didn't make it being open access a criteria or a necessary feature. So it is possible that a subscription-based journal fails to uphold best practices, doesn't meet particular standards, says they do a particular behavior, but then don't necessarily do that. So I think the onus is upon journals, irrespective of how they publish, to actually show that they're being transparent and they're meeting best practice standards.
Right. So more on the lines of being open access. So if the journal or the paper is targeting the patients or maybe just the general public, how would the general public know that it's if it's open access, whether or not it's predatory or not? Because they might not have a lot of expertise in maybe reading journals or knowing what the signs are.
Yeah, it's a really great point. Like we're in a situation where many researchers can't even detect the predatory journal, so we can't expect that the average member of the public would be able to. So that's something we're working actually as part of our research on predatory journals. We've incorporated patient partners into our research because they provide that perspective and they help inform us and contribute ideas for how we might create tools to actually support researchers in doing that. So, for example, I've mentioned this online journal tool plugin that we're hoping to create. We have some patient partners that have been fantastic in working with us as part of that. And we're going to be using a user-centered design where they contribute their ideas for how that plugin might actually be useful for them too. Maybe it would be a different sort of face of the same tool, like, you know, the digital tool draws the same information but presents it differently. So we're that's ongoing and we're working with them. And I think that that's something really important to do, particularly because we're also engaging more and more researchers as partners in our research. So if we're expecting patients to contribute, equally to research projects, and they often are empowered. They read the literature. They want to contribute and be knowledgeable. We need to provide tools to support them in doing that effectively. And I think that's sort of what your question speaks to. And I think right now those tools aren't there, and that's a really unfortunate situation.
Right. So do you think that, or I guess academic journals, do you think they do a good job at translating knowledge to the public, or are there tools that can maybe be developed to do that?
I think that presently, for the most part, it's suboptimal, to say the least. It's there's more that journals could be doing. With that said, there's been a lot of changes. So, for instance, like mini journals such as the BMJ, they have now lay summaries of articles. So that's something that can be helpful. How those lay summaries are then actually communicated and they find themselves in the hands of patients or members of the public, I think that is where we need to put more effort and improve. I think things like what you're doing today, interviewing researchers and having discussions about what they're doing, through reaching them through podcasts or the radio or YouTube, that's very effective as well. And one thing that I think as a research community we need to do is actually better acknowledge and reward that behavior. So when I, go out for tenure or promotion, or when I try to apply for a new position, that's not typically considered as something of value. So in many systems, they look at number of publications, the journal impact factor, these types of things. But communicating science to the public and having the public exchange is so critical to shaping quality science and doing science that is even on topics that are relevant to the publication the research community. So
yes, I think you got exactly what we're trying to do here with this podcast, is communicate what's being done in research and academic fields and translate that into a way that the public can understand and maybe be more engaged and understand where taxpayer money is going in order to get these solutions into hospitals and understand science at a more more depth. So,
and for any like researchers tuning in, I would really encourage them to seek out opportunities to do that, but also incorporating patients, if they're in a biomedical field, or citizens in their research, because it has been so rewarding for us. The types of questions that come up are sometimes they seem very simple, but it's like, it's like completely basic to the core of what we're doing, and having them really at the table contributing has been really very valuable. And increasingly there's more and more funding to support involving patients or citizens as partners in research. So that can be something very positive. And I think that funders are recognizing it, journals are recognizing it as well. So some journals now require a patient to be part of the peer review committee. So for instance, the BMJ also, they do this. So your paper is going to be reviewed by a patient. So if you've not considered patient preferences or values or brought in their perspective in, that's probably something they won't look very kindly to. So I think we're moving in that direction, and I hope the movement increases in speed.
Do you see a certain field incorporating patients or a member of the public in the review process in a specific field more often than in another, or
not in like sort of a field specifically, but I do think it's the inroad has been easier within clinical research than in basic or preclinical research, but nonetheless, it's happening in that space as well. I think sometimes researchers struggle to see the connection there, the immediate connection, but those sort of early adopters forging in this space, I think, are making that more clear to the community.
Right. Okay. Very interesting. So what do you think could be done more to improve this knowledge translation? Do you think that the broader scale media, so like CBC, those big platforms, do you think that they're doing maybe a good, or what could they do maybe to help this? Because I find that sometimes there's a very like a really interesting paper that's published in Nature, but it's maybe it's very like it's ways away from being in the clinic, and people get very excited about it. Do you think that the media is doing a good job at translating this knowledge effectively, or maybe kind of giving false hope in that sense?
I think that we need training from like both perspectives. So we need to make sure that our media and those communicating our science are trained in terms of study design and sort of quality as well, so that they can really sort of point to what you're saying. Is this something that is part of a line of studies that's supportive view? Or is this really like an intervention ready to go bedside? And there's a big distinction, and that needs to be made clear when we're communicating our science. But I also think we need to communicate with our researchers and educate them as well in terms of how to communicate their findings. We have our own sort of onus and responsibility to do that, and there's ways that we can be creative, and it doesn't even necessarily have to cost a lot of money that we can be doing this. So I think it goes in both directions. I think the tendency to sort of spin our words to make our research sound more exciting or more significant, both in publications and also in when we communicate, is there either consciously or unconsciously, because we're in a very competitive system. We're trying to get funding for what we're doing. So I think again, the way we value and reward science, it can create perverse incentives and behaviors. So if we change that valuation system to support, quality, transparent science, we value communication, people will put more time and effort into doing those things.
Yes, definitely. So these tools that you're talking about to maybe accomplish these tasks, these things in all these different fields on a broad scale, when would we be able to see them available as a plugin on Google Chrome?
Yeah, so we're really excited. So we just got some funding locally from Tehamo to develop a prototype of our Journal Authenticator plugin. So we'll be working on that this year. So we hope to have that prototype by the end of the year, and we'll work with our international community to really make sure that prototype is usable for say patients and the public, but also researchers, and even say journals and editors and other stakeholders, funders, for instance. And then we'll work to translate that and make it available. So we hope to make it available as soon as it's completed, so to speak, but relies a little bit on funding as well. So we have the core funding for a prototype, and then we'll be seeking funds for additional funding to really scale it up to something that's very usable.
So what would the user expect to see when they open up this plugin? What are some of the parameters that you're using, or the metrics?
So some of that it's hard to say, because we are using a user-centered design. We're really drawing from the community in terms of what they need and what's usable for them. So it may be that the needs of, say, patients are different than, say, researchers, as they may be different from funders. So there may be different phases, so it's hard to say. But as we sort of envision it presently, we would imagine maybe something like a stoplight that would pop up, and it would be red, like do not publish here. Amber, you might want to look at this a little bit more. And green, this seems to be a vetted, genuine outlet. And those particular colors would be drawing and produced from various APIs for things like, whether it's indexed or not, whether the journal's open access and is it in the DOAJ. Do they have, for example, public peer reviews? So if I can see that the journal is doing peer reviews and they seem to be substantial and of some degree of quality, then that is a pretty good sign that this is not a predatory journal. Their peer review is considered to be one of the sort of critical aspects of a peer-reviewed journal. So that's sort of what we envision, but we'll see as it plays out. We're doing some focus groups and things like that to see what the needs are.
Right, so more of a very user-friendly, like just the first sight, okay, maybe this is not a good spot, I'll move on, but I guess also pulling up all of that statistical data based on your
so those who want more information, perhaps they might click on the icon and learn more. But for many, it's enough to say what I'm reading is not quality, So I will not continue reading, or I will not continue to submit if I'm a researcher. So we want to make it very practical, because for the average researcher, their time is very short in terms of what they're doing, and it may be that's enough. They don't need to know why, but if they do, that information is available.
Okay, very interesting. And this plugin would be open access, I guess, free?
Yeah.
Is the hope?
Yeah, it would be open access and publicly available, so that anyone could use it.
That's very interesting.
Yeah,
I think that would be a very useful tool. I'll download it.
Excellent.
I have another question that's a little removed from what we were talking about, but I thought it was interesting. So it was more on the topic of publishing negative results. And in the field of science, it's always, we did this and it worked out great. We did this and it worked out great. And I think the importance of publishing negative results is very useful for the field. In your research methods, do you see this at all when going across predatory journals? Do you see any negative results come up a lot? Or?
Yeah, so that's something that actually a graduate student has recently mentioned they want to look at, is if work published in predatory journals tends to be more statistically negative, actually. So that work that can't get published in genuine journals, people might use predatory journals as a way of getting it out there. Although there are other opportunities that they could use, they may do that. So that's something that we're interested in looking at more. I think in general, publication bias or this bias towards statistically positive findings is a problem, but I think it's improved tremendously. Even in my career, I've seen major changes that suggest that people have recognized this as a problem, and they're addressing it in some way. So one really great example is something called registered reports. So some journals have introduced these. There's a list of over 100 journals that now have registered reports, and what they are is when a researcher creates a protocol from their work, and if they need REB approval, they get that. They then submit the protocol to the journal. And the journal peer reviews the protocol in much the same way they would a journal article. And if the reviewers are positive, and you may have to make some revisions, they basically accept your work in principle, so to speak, if you follow your protocol. So basically, irrespective of the study outcomes, if you adhere to the protocol or you make deviations that are understandable and explained, which is normal in any course of any experiment, there's often deviations that occur. Anyway, if you do that and you adhere to your protocol and then you submit your finding, they commit to publishing it irrespective of outcome, so long as you adhered roughly to the protocol. So that, I think, is a bold step by journals to move towards supporting research methods and rigorous science, as opposed to something statistically positive or p less than 0.05. So
because sometimes in the methods, it's very hard to see exactly what people are doing. So this journal you're talking about is basically just methods only? Or?
No, so there's hundreds of journals. So, for example, PLOS ONE, which is a major non-discipline specific journal, they just announced that they're accepting registered reports. So this is something that they will now do, but there are some clinical journals. I think some of the cognitive sort of neuroscience journals were amongst the first to really start this. The psychology community has also been very forward in adopting this, but there are many sort of non-discipline specific outlets now available.
So what would be your advice to maybe young students or researchers who want to know more about publication ethics and predatory journals? What would you recommend to them as kind of furthering their knowledge on that subject?
I think that if possible, if in their vicinity there's someone they can find as a mentor or someone who has those skills, that would be great. As a starting point. There's a ton of meta science research out there. There's also conferences ongoing. We have our center here in Ottawa, so if it's someone local, they can definitely reach out to us. We're always happy to involve people in what we're doing. We also run workshops for students. We have a course now at the university. There's growing sort of recognition that this is important. So I spend a lot of my time doing guest lectures at various institutes, and it's fantastic to reach so many different researchers, different stages, different sort of career focuses. So there is resources out there. You have to look a little bit, but as a starting point, we'd be happy if you checked out our website and looked at sort of what we're doing. And you can see from our website, it will signpost to other events and conferences elsewhere too.
Okay. So what would be your long-term goals for your field of research here?
So I think from my perspective, a long-term goal would be to basically make parts of the scientific enterprise more evidence-based. So I think we have a system that we work in, and we all just sort of, or many of us have accepted, because that's the system of metrics used, that's the process of publishing, that's just how it is. And I think that that's unfortunate, and I think that we need to evaluate and measure and audit and provide feedback on how that system is or is not working. And just like we would with like a disease in like a clinical study, we can develop interventions to target the disease or the problems that are occurring. And we can test and measure those interventions and see if they're effective in moving us towards goals in terms of transparency, promotion of quality rather than quantity. So I think if I was to end my career having had an impact on raising the overall quality of that system in some capacity, that would be a really positive thing.
Very interesting. Well, I'll be on the lookout for the plugin in the next little bit. And thank you to all of our listeners for tuning in today. And we'll catch you a little bit later on our next episode of BEaTS Research Radio.
Thank you.
BEaTS Radio, scientists interviewing scientists. Canada is a worldwide leader in science and innovation. However, our communities need to be more connected to current scientific research in order to drive the future of scientific innovation. So what steps can we take to more actively engage and connect our community with scientists and vice versa? Innovation and discovery are at the core of the current efforts of our government, but science sometimes gets slightly complicated to understand. At BEaTS Radio, we will tackle this by having young scientists and early career researchers interviewing scientists and innovators. By dissecting science in simple terms, this will allow our community to better understand the importance of science for our country.